The Uganda Medical and Dental Practitioners Council, responsible for overseeing medical schools in Uganda and East African region, appeared before the Education Review Commission to share insights into medical practitioner training and assess whether practicing doctors meet the required standards. The current system of joint inspection and accreditation in health professional institutions and programs was criticized, citing a court ruling allowing the internship registration of individuals from an inadequately qualified private university.
But we talked about a tribunal whereby we say we should have these matters resolved by people who know the ethics, the technical, what is required of a doctor, and what would be the implications of deploying somebody just because the court has ruled and yet they are actually not qualified.
The council identified a deficiency in the admission criteria for health professional training institutions, emphasizing the need for a structured pre-admission interview to assess candidates' attitudes and conduct. Regarding the recommendation for a national university or institution examination for all medical graduates, a commissioner raised concerns about its justification, given the current emphasis on continuous assessment in education.
Competence-based learning. If we examine students at the end and probably at the end of the year, and especially medical students, which is almost, I don't know what percentage practical in the training, what would be the justification for these examinations? And if so, which kind of examinations?
Not many exams. Can I tell you that every patient that we see is an exam? So nobody should be scared of exams. Nobody should be able to say you're giving us too many exams, because every patient that you see is an exam in itself. Yeah.
The council pointed out that gaps in health practices and doubts about standards have diminished the reputation of medical doctors. One commissioner questioned about the origin of doctors' training.
You are saying we are going to ask. Very soon we shall be asking when you go to a doctor, where you train. We are already asking. It's not for the future, it's current, present. When you go to a doctor now, you ask and say, where did you train? I was talking to Maxwell when we went out. Because it is scary to go to a doctor who is not qualified to be a doctor.
A commissioner suggested that the council focus on improving training frameworks and urged scientists to devise methods for producing locally made scientific inputs rather than relying on imports.
Inputs are important. Is it possible to tilt the curriculum or possibly create a completely new one so that the medical scientists can help us get some of those products, because we are consuming everything is important.
The council recommended that the government offer scholarships in critical areas with severe shortages such as oncology, neurosurgery and heart surgery, and emphasized the importance of retaining locally trained specialists. I'm Nafka Farida and Sana Anet in Kampala.